Everyone, please join using the link provided in the YouTube live comment section. In the YouTube live chat, link is provided for the quiz. Kindly join the quiz using the link provided.
Hi guys, we'll be starting the quiz exactly at 10:10 p.m. I hope everyone is ready. Buckle up because it's going to start the quiz at exactly 10:10 p.m. The link for the quiz is shared in front of your screen. You can scan the QR code or type the website. And along with that, we have shared all the details through our Telegram channel, WhatsApp channel, all on our socials. So be ready, guys. 10:10 p.m.
The link for the quiz is given in the live comment section, live YouTube live chat comment section. Oh my God, one of them has just named himself as RMD.
All right. Let's see.
People come up with so many creative ideas. This was very unexpected.
All right. Guys, remember we focus on telling you to write your actual name because you'll get your certificates and rewards on that name itself, no? So just write your own name. Next time we'll just reward Sir only. Dr. RMD has won the quiz. Someone has already named themselves winner itself. Arey wow.
Yeah. People are getting creative.
All right.
So almost 30 people have joined. We'll wait for 4 more minutes.
Yes. Guys, today's topic is neonatology, and we'll be conducting 10 quiz, 10 questions on it. All of these are your PYQs and PYTs. All your feedbacks and any kind of questions that you have are all appreciated. You can ask us, let us know in the comment section as well. And do let us know if you like the quiz and how does it feel.
So today's topic is neonate plus infection. If you had watched my video on NEET PG strategy for 2025, you will notice that infections had very much high weightage and priority factor. As I mentioned, that is number of hours dedicated versus the output that you get. Okay, so the output that you get out of infections is very much higher compared to the input that you give. That's why the priority factor is very high for for infections. That, along with neonatology, will form the core of pediatrics. Okay, so there is no way you can skip this topic. That's why I had also told that when you study infections and neonatology, you'll have to solve all questions on QBank. Okay, you'll be watching, you'll be reading from main video notes, and then you'll be solving all Q bank questions. Okay, so if you have done that, then today's quiz will definitely be able to be in top
Right.
5.
Yes. I agree, sir. The fact being that you're reading it from your main content along with, revising it by giving all these, solving these Q banks makes you help, keep a concrete base and you understand where things are little less tacky for you and where, you can tackle them properly. So let's see how have you performed. We'll be starting the quiz at 10:10 p.m. in
2 more minutes to go.
yeah. Guys, remember all of these quizzes and everything are a very cutthroat competition, and you should be cutthroat at least in your knowledge. That is the least you can do. So, in case ever you find any new information or anything that you find as a correction as well, you should always update it in your book, in your notes, so that when you're revising, it is a little gets easier, and you don't forget the points. 1 minute to go, guys. A minute.
Whoever has joined late can still give the quiz. Okay, it's not like you can't join in between. You can join anytime. Okay, but we'll be directed to the question which is already which is on the screen. Okay,
Three.
you
Right.
won't be able to attempt the previous questions. Okay,
And
so let's
all,
start.
yeah, so just one last disclaimer. Guys, there are no negative marking. Please understand, over here, there's no negative marking. So you can always put down your thoughts, put whatever you think, right? There are no negative marking. All right. So just be accurate and let's start with the quiz.
So welcome everyone to JuxtaMed session on pediatrics, January 17th session. Today we'll be discussing neonatology and infections.
Right. Good evening, future doctors, med enthusiasts, and all our fantastic JuxtaMed fans. Welcome to another episode, an exciting episode of JuxtaMed, where knowledge meets fun, and we tackle your toughest medical questions with a side of humor. I am Dr. Rupal, and
So
Dr. Manoj will be joining us very soon. Let's
let's move
start
on to the
first
let's move on to the
question.
first question.
Right. Here we go. A newborn is classified as having a low birth weight if the weight at birth is.
This is a straightforward question. This might be asked as multiple choice question when extremely low birth weight, very low birth weight, and low birth weight are mentioned. Okay, so I guess this should be a pretty easy question.
Right. It's like the baby question.
Yes,
Ah,
majority of them have got it right. Good.
right. Good. Moving on to the leaderboard. Ouch.
Okay, so what are these names?
Oh, goodness.
Okay,
All
well,
right.
and all four of them have the same score.
Same score. And Thorn Princess is actually thorning up on the leaderboard. So let's move on to your next question. All right. Today, old full newborn in full term newborn presents with multiple small erythematous macules and papules on the face and trunk. The baby is otherwise healthy and feeding well. What is the most appropriate management?
So again, a straightforward question. The case scenario makes it a bit confusing, but again, look at the image. I guess you must
Yes.
be very much sure about the answer by now. Yes, it is.
Hey, so everyone got it right.
Yeah. So it is erythema toxicum, and there is nothing you need to do with this.
Right. I'm glad. I'm glad.
So leaderboard shows Tom Princess is leading, followed by Ashish, Tanya, Soumyashri, and Krishna.
Right. I would say then peds is one of the baby subjects and also one of the scoring subjects. And if you know, you know. And right now, the competition is just stating the fact that you know the answer and how fast can you answer.
Yeah,
All
right.
right. So moving on to your third question.
A newborn is delivered via vacuum-assisted vaginal delivery. The newborn becomes pale, has low BP with negligible pulse. The swelling is diffuse in nature. What is your diagnosis? Again, read the question properly. This is a dreaded complication of vacuum-assisted vaginal delivery. If you know the answer, you can press. Your time is ticking.
Tick, tick, tick. Tick, tock, tick. All right. Come on, let's see who got it. Hey,
Yes,
guys.
only 13 have got it right. Yeah, this was one of the tough questions, we can say.
So
So we introduce you.
I would say it's not a tough question. It's just a little confusing for them because I would say the more when we talk about caput succedatum and subglear hemorrhage, both of them have a little similarities. Like both of them have diffusion and both of them have blood. So guys, when it comes, the whole part was just vacuum assisted vaginal delivery. So that is where you catch the point, right?
Right,
So,
right. Yeah.
yeah.
Dawn Princess has come prepared, but winner is leading now. Dawn Princess and winner both. Followed by Karthikeyan, Malcolm, and Priya.
Yeah. So, and you
Good.
can see Thorn Princess and the winner are on the
Yeah,
same
right.
points.
Yeah.
All
Here is
right,
your fourth
guys.
question.
Yes. A 4-year-old child presents with high grade fever, sore throat, and painful swallowing for 2 days. On examination, the child has grayish white membrane over the tonsils and pharynx that bleeds on touch. There is also cervical lymphadenopathy and mild neck swelling. What is your diagnosis?
It's again a classical question. So, with the
Mm-hmm.
classical diagnosis, you can't get this wrong. Yes, almost
Hush.
everyone has got this right. This
Right.
is the answer.
Nice. Nice going, guys. Good going.
One more question that can be asked on the same is a complication, that is myocarditis and neuropathy caused by diphtheria.
Hmm. Nice. Thank you for that information, sir.
So winner is leading, followed by Malcolm, Karthikeyan, Dawn Princess, and yes. Good.
Yes, all right. Okay, moving on to your fifth question.
The 32-week preterm neonate on enteral feeding develops abdominal distension, vomiting bloodstream stools on day 5. On examination, abdomen is tense with erythema over the abdominal wall. X-ray abdomen was done. X-ray abdomen shows classic finding. You can't miss this at all. So you have
Mhm.
four differential diagnoses. Your time is ticking.
I would say it's a tricky one, I agree. So it's a gut punch of a diagnosis.
Mm,
Hmm. Good.
yeah.
Goody
So
good.
almost everyone has got this
Got
right. So
this
it's
right.
necrotizing enterocolitis.
Nice.
So
Oh,
Malcolm is reading now, followed by Karthikeyan, Thorn Princess, Winner, and Priya.
all right. Nice going, guys. Good going. Moving on to your sixth question. The faster you do, the better marks. A 5-year-old child presents with high grade fever, drooling, and difficulty breathing. On examination, the child is sitting in a tripod position. What is the most likely diagnosis? Let's see.
So the clue in this is high grade fever, where you will see the child is toxic. Second is drooling, which means there is something blocking secretions. Okay, the child
Hmm.
can't swallow, and difficulty breathing. and this tripod position. So all these are classical of epiglottitis. Yeah, I think this
Yes.
needs to be cleared. Croup and epiglottitis. Croup is laryngotracheobronchitis, which is not much of a severe condition. There you will get brassic type of cough, and the most commonly asked question is, what is the treatment that you give? You give ADR, one is which is effective, humidified oxygen. Okay, these two, and in some cases ribavirin. But in epiglottitis, which is most commonly caused by bacterial causes, it is a life-threatening condition. Okay, so you need to differentiate between epiglottitis and croup. Only then you'll be able to answer in your exams.
Mm. All
So
right.
Malcolm is leading, followed by Karthikeyan, Thorn Princess, Priya, yes, Komal, Soumya Shri, Ashish, Surya, and Sushma. Okay, good.
All right. All right. So moving on to your seventh question. Which
Which,
parasite, yeah,
go ahead, go ahead.
which parasitic infection is most commonly associated with perianal itching in children?
Yeah, so the itching is the clue to this. Okay, so you will see worms coming out of perianal region, out of the anus in the children. Okay, so this particular worm is what you need to identify. You can also be getting images of these worms in your exam. Okay,
Hmm. Right.
so yes, most of them have got it right. It is
Right.
Enterobius vermicularius. Good.
Nice. Nice.
So you can have extended question on this, that which is the diagnostic method that you'll use for this and what is the treatment. Okay, these two can be extended questions of this question. So
Okay.
Malcolm is leading now, followed by Karthikeyan, Thorn Prince, Priya, and yes, so almost the leaderboard is pretty much the same.
Oof.
So let's move on.
Cutthroat.
Yeah.
All right. Your eighth question. What's the greatest risk factor for intraventricular hemorrhage in neonates?
So
Come on, guys.
you have four options, and one of this is very important. It is also found around 32 to 34 weeks. Okay, that is the time when germinal matrix gets matured. Okay, so once this germinal matrix is formed, then the risk of IVH decreases. There are two questions connected to this. One is what is the risk factor, and the second is what is one drug which you can give can prevent it. That is corticosteroids. So yeah, prematurity is the right answer.
All right. Ah, the tables have turned.
Karthikeyan is leading right now, followed by Thorn Princess, Malcolm, Yes, and Priya. Good.
And nice, nice, nice. Moving on to your second last question.
Which of the following is a major complication of fetal macrosomia during delivery? So complication of fetal macrosomia. Okay, it is not the other way around. So you have four options. Your time starts now.
Along with that, we can say that delivering a baby with this much weight requires some serious finesse.
Yeah, big baby problems. Sounds like a delivery room nightmare.
I suppose it does.
Yes, almost everyone has answered it right. It is shoulder dystocia.
Nice. So
And
everyone has read and come up. Everyone.
you'll also get maneuvers used for shoulder dystocia. And I remember one of them, Robertson's maneuver, I guess,
Hmm,
which
hmm.
is frequently asked. And there are many other maneuvers also for shoulder dystocia. Okay,
Right.
so Karthikeyan is leading, followed by Malcolm, Thorn Princess, Yes, and Soumya Shri. Good.
All right.
Moving on to the last question.
The final question. Which cell type produces pulmonary surfactant? It's a baby question, guys. It's a classic
Um,
baby question.
This is a physiology question to be exact. I think even in histology also this question can be asked.
Yes. Yes.
Uh, I think you can straight away rule out two options, then you have only two left.
Two
And
left.
out of that, the clue is one forms 95% of the total respiratory epithelium, its function is diffusion. The other forms 5%, and its function is secretion of this pulmonary surfactant. Yes, almost everyone has got it.
Yes, got it
Thank you
right.
very much. Very good, guys. So you guys have been answering more than what we expected.
Expected. That's
So
true. That's true. Whoa.
Karthikeyan is the winner of today's quiz, and he has answered All 10
All.
questions correct. I think Malcolm and Tom Princess have also got all of them right
Okay.
because they are,
Wow.
yes, you deserve applause.
Yes. Woohoo. All
Second place,
right.
we have Malcolm, and at third place, we have Tom Princess.
Conferences. Congratulations, guys. Congratulations, Karthikeyan.
At
You
fourth place, we
guys.
have, yeah,
Yes.
yes. Fifth, we have Sushma. Sixth, we have Priya. Seventh, Medha. Eighth, Mahima. Ninth, Krishna. Tenth, JSN. So we have many new players who are attempting this quiz, which is actually a good thing, which means the quiz is actually helping them.
Yes. I'm glad to hear that as well. Uh,
So, guys, come back to YouTube Live. Let's have a small discussion on suggestions or any other comments that you want to give. We'll be looking at YouTube Live section comments right now.
mhm.
So if you have any comments, any feedback to share, or any improvements, you can mention, or any doubts with the questions. Okay. So we'll be looking for that.
Right.
So Destiny has asked that I don't have main notes. Just RR is there. Okay, fine. Whatever you have. If you have RR, then you have to make sure you bookmark important pearls and you also go through all questions if possible because you have not covered through your main video notes. So it is better you go through all questions in Q bank. Okay. You will have extra time because using RR, you will be finishing very quickly. Okay. So anyone has any comments, please drop your comments in the live chat section of YouTube video. We'll answer them. And congrats, Karthikeyan. You have won the
Mhm.
quiz. So
Right.
Harsh was as Harsh, sir, infections is spread over all systems. So what all to study? Whatever is given in pediatrics, study it, okay? Because from pediatrics, we have noticed more number of infection questions. That's why from pediatrics you study. One more topic is antimicrobials from pharmacology, where many questions are asked. Okay, these two topics from medicine and all, it is like you will anyway study from microbiology, so not much of a problem. But from pediatrics especially, you are getting easy questions from for infections, so which are specific to pediatric age groups. Okay, like for example neonatal, like for example torch infections. These are all very easy ones. Okay, so you are not supposed to miss them. Mohan is asking, sir, what will be the revision strategy? Revision strategy will start after April 15th. Okay, April 15th to uh, May 18th, that is till your INICET will be your first revision, and after that till NEET PG, that is June 15th, will be your second revision. Kalyani has asked to make us 20 questions. 20 questions is a little bit difficult for us and it becomes boring also. So whenever we arrange grand finale, okay. So
Yeah,
pediatric grand finale we have on 19th of December. So on that day, we'll be having 20 questions.
that's right.
Sai Krishna, sir, no questions on APGAR. If you see questions of last, I think 1 2 years, so you don't have any questions on APGAR also from in NEET, okay? So it's not like you always get questions on APGAR. Okay, so
True.
Astadi has asked, systemic pediatrics, one day we can't cover everything, we may need 2 days. No, that is the point, no? You don't need 2 days because from systemic pediatrics, less number of questions are asked, okay?
Hmm.
Also, for that grand finale, which we are having on 19th, you have one extra day. That time you start revising systemic pediatrics if you haven't gone through. Okay? Systemic pediatrics, again, I have made a classification in my NEET PG strategy video where I have told how to study each topic of systemic pediatrics. So go through that. Okay.
Right.
Vishnu Priya has asked, if possible, please include questions, sir.
Yeah.
I didn't
Uh,
understand what you meant.
like, did you mean INI based or NEET PG? Is it something like that or like what?
Okay.
Spare
Harshwa is
article.
asked, sir, BTR and RR together works. Then you will need question bank also. Without question bank, it is not useful. Komal has said your YouTube comment is little slower than the quiz. Yes, it
Uh,
should be because we are giving hints and clues. We sometimes even tell the answers in YouTube live commentary. So that is, the delay is actually because of the Zoom to YouTube connection. It is around 5 to 10 seconds delay. Okay,
delay.
it is nothing that we can do, but it is actually useful for us because by the time we tell answers in YouTube, you will be in the next question in the
In the
quiz.
quiz. Right. Guys, increasing the question. Come on, like how many questions are we talking about? How many do you want to like, just keep solving the Q banks? Like you do that. Over here, we're just trying to, help you out in a fun way and also help you to validate yourself. So increasing the questions is okay, but at least right now you'll know that what exactly PYTs have been asked more frequently as compared to others. So fine, we will think about it. And since everyone is requesting, we will think about it, but we'll think about it.
The whole point was to keep this session very quick and short, so that just before you go to sleep, you get a like a touch of revision, you get something fun, you get something entertainment. So if
Yeah,
it is 15-20 questions, it becomes too boring. It becomes like solving another Q bank.
bank. Yeah.
Harsha has asked with internship completing daily goals is a bit hard. Any tips? Whatever you can complete it, do that. Okay, because once your internship ends, you'll have 1 to 2 months time, so you can finish rest of the things later on. Okay,
And
fine.
guys, if you finish, like, so just take an example for today, since we have got neonatology, it's like, how much ever you have read, no, read it and make sure whatever you've read, it's just in your head properly with the basis. And along with that, if it is not done, just leave it. Just know how much have you done, and then whenever you get the time, you read again, you revise, and you continue from that, so that you try to do everything what is required in a day itself, and in case it's not possible, just leave it till apps punch and continue with the rest, so that you know how much have you left and you're not even falling back.
Okay, I guess that's all for today. So we'll be
Yes.
meeting you guys tomorrow at 10 p.m. with a new topic, brand new topic, that is systemic pediatrics, which are supposed to finish in 1 day. And I tell this because it is less important topic, okay, compared to general pediatrics and neonatology. So all the best, prepare well for tomorrow, and we'll meet at same time 10 p.m. Till then, good night.
Good night, guys. Keep those brain